Hi there, it's Dr. Julie with Summit. I wanted to talk with you about the side effects for the GLP-1 medications. So GLP-1s are semaglutide and tirzepatide, and the side effects. So the medicines help slow the body's stomach emptying down, which is where a lot of the side effects come from. So some people will get nausea, some people will get a little bit of heartburn, some people will get, quite a few people we found get constipation. There are definitely a handful of people that get diarrhea with this as well. We find that people will get side effects oftentimes the very first day of their shot because the body's like, oh my goodness, there's something new in my system. The medicine itself peaks midweek and then starts to taper off before your next shot after a week. So sometimes people will feel a little more nausea in addition to a little bit more appetite control at that midweek. The other time, sometimes people will feel side effects is at the dose increases. So that's usually every 4 doses, we go up in dose. Semaglutide, there's 5 different dose levels. Tirzepatide, there's 6 different dose levels. We have found with tirzepatide, most people actually do awfully well with that 2nd or 3rd dose level. So you don't have to go a lot higher than that. We do find that semaglutide does have some more side effects, and especially heartburn. So if you start with heartburn, you might not want to start with semaglutide because it might make the heartburn even worse. Some people will get a little bit of a headache. There's some people it's triggered their anxiety, not many. And then sometimes just going down in dose or switching medications can help a lot of those side effects. We have found that there's been a few people that have had some hair loss, and that's an interesting phenomenon. It's not necessarily from the medication itself, but it's from the rapid weight loss and the stress on the body. It's called telogen effluvium, and instead of the body losing 50 to 100 hairs a day on a kind of a constant ongoing cycle, those hair follicles kind of sync up together and then lose at, in more lose together. And so like I had this for a few months. It started after about 3 or 4 months. I had it for about 3 or 4 months and then it stopped. I went to my hairdresser and my dermatologist. They said my hair follicles looked fine. It was just in this telogen effluvium cycle. We can see this in people when they're pregnant, when they're under stress, when they're undergoing other medical treatments. So just something to keep in mind. Some people have had gallbladder flares, but again, it's not directly from the medicine. It's anytime there's rapid weight loss, the gallbladder can flare. We do know that since the body produces insulin on a more steady basis, sometimes this can flare people's pancreatitis. So if you've ever had pancreatitis, that can be something to consider if you want to go on the medicine. In mice, they found there were a very small contingent of mice that were found to have this really specific kind of thyroid cancer called thyroid medullary carcinoma, or a second condition called multiple endocrine neoplasia 2, MEN2. So in the studies that I've seen so far, we haven't seen any humans that have actually developed that, but we're being careful. And even though this class of medicines have been out since 2005, if anybody has had that particular kind of cancer or anybody in their family, we don't want you to start on this medicine because we don't want it to come back. Many of our patients do have thyroid conditions like hyperthyroid, hypothyroid, but as long as you don't have that really specific kind of thyroid cancer, then you should be safe to go on the medication. Let's see, any other side effects? I think that pretty much covers it. If you have any questions, let us know. We look forward to teaching you some more about the medications.